Hi, my name is Dr. Dave Farnsworth, and I am a hospice doctor and a family doctor here in northern Utah. And I'm joined with Dr. Millard here, who works at the VA. And we're here to talk today about providing care, specifically in a hospice setting for veterans. I've got a few questions for you, Dr. Millard.
Sure.
So can you share with us what specifically drew you to working with veterans in your medical care?
Yeah, I think there's a couple of things that I love about working with veterans and what sort of drew me there. Number one, I like geriatric patients. I like kind of the older population, and so you tend to get that with veterans. And number two, it's kind of a small way to give back. I'm not in the service myself, and so this is a small way to sort of give thanks and give back to the veterans who have put so much on the line for us.
That's awesome.
Yeah.
And so what would you say is the most rewarding or meaningful part of your care for veterans?
I think probably the most meaningful thing is being able to make a small difference for these veterans. You know, I think a lot of times veterans have been, they may mistrust the medical system more than the average patient. And so in my line of work, doing hospice and palliative care for veterans, I get to sit down, spend a lot of time with patients, hear their story, ask about their time in the service if they want to talk about it. And so I just think that being able to kind of give them my time, build their trust, is just something that they might not get in every field. And so being in the hospice palliative where we have a little bit more time has been just super rewarding.
Yeah, that's awesome. Veterans have a lot of great experiences and stories, for sure. You're going to get a lot of good stories and a lot of those experiences that most people have never seen or experienced. So, and how has your experience working with veterans shaped you as a physician, do you feel?
Oh, it just opened my eyes to, a sort of group of people that I wouldn't have otherwise had exposure to, and just open your eyes to the unique experiences that veterans face in their lives, socially, and also in their healthcare specifically. So it's just one more sort of exposure, I think, to a group that I otherwise really wouldn't have known about. So opened my eyes to the unique challenges that veterans face. Obviously, we know that they're more likely to have PTSD than the general population, and they, like I said earlier, they might mistrust the system more, and they might they almost certainly have, social issues that go along with being a veteran, with having to move unexpectedly, if they get called away and having to be apart from family. And I just think all of that sort of shapes who they are as a person and shapes their medical care.
Yeah, absolutely. You mentioned several unique aspects to that. Are there any similar mindsets? You mentioned maybe a little bit of potential distrust in care and things. Any other mindsets that you've noticed that are similar amongst veterans that maybe could talk about? Or personality traits?
Yeah, I think what I experience is I think veterans are quite thankful for medical care. I almost always at the VA, we get, compliments. Thank you so much. This is such a great place. And so to me, it does feel like an especially sort of thankful group of patients to care for, which is obviously nice. And so I have noticed that. I do also feel like veterans are often a little more, might be a little more private, might be a little more kind of keep things close to the chest. And I've learned that asking about their service, asking about, once you have a relationship with someone, sort of asking them to tell you about it goes a long way. They obviously don't have to talk about it if it's not something they want to share, but if we don't ask, we don't know. We can't, sort of put something on their medical chart that's very pertinent if we don't ask. Hey, tell us about your time in the service, or how many years, or were you deployed? I mean, those things obviously, really can matter. And so they might be a little bit, more reserved, but asking about it. And oftentimes you'll hear a lot of, very fascinating stories, and just really get an idea of how this shaped their lives.
Yeah, definitely. That service is something that is, it shapes their life, like you said. It is something that they're proud of, but it also provided a lot of challenges. Are there certain kind of physical or mental health challenges that you've seen that are maybe more common amongst veterans, or things that you've seen are typical?
Sure. I think we all know that the buzzword PTSD, patients who have been in the military are much more frequently diagnosed with PTSD for obvious reasons. And that can affect even how you physically approach a patient, right? I mean, you want to make sure you don't ever feel like you're cornering a patient who might have PTSD, or kind of blocking their exit, and so kind of this idea of trauma-informed care. So just being aware of these things, PTSD being, the number one mental health issue that comes to my mind, but also a lot of social issues. They might have strains in their families because of these moves they've had to make. They might not have a lot of control over their, where they live, or what they're doing for, for that year, if they get deployed, et cetera. And so I think having that control taken away from them is tough. And so giving patients back control wherever we can, and making sure they're, an equal partner in making decisions is super important.
Yeah, that's great. And I think that trauma-informed care, that's something that you mentioned that providers are learning more and more about these days. Are there any things that you wish that physicians and other healthcare providers kind of, maybe some tips for them, or things that you wish they had known or were able to do to take care of veterans better? Because you get a lot of experience with veterans, obviously.
I think outside of the VA, it's important to remember to just ask. Are we asking our patients, are they veterans? Did they serve time? And inside the VA, it's a no-brainer, right? I mean, we know that they were, but outside of the VA, are you asking? It's just as important as saying, are you married? Do you, what do you do for a living? Are you a veteran? Were you a veteran? Like, what are some of these things that could really, really impact your healthcare? And so, don't forget to ask.
Yeah, okay, great. We talk about cultural competency, or the ability to take care of various groups. And you, as a medical director within hospice, are there things that you teach your team, or kind of help with other people in your team to understand that cultural competency, or things that you've done to help others in that regard?
Yeah, I know it's pretty common for our hospice employees to go through trauma-informed care trainings, and so that they are learning these specific ideas, kind of like what we talked about, is to know that these patients may be, have past trauma. They may have PTSD. They may might need a longer time to warm up to their healthcare team, and so they go through trauma-informed care, and we try to. Oftentimes, veterans have very close relationships with their providers at the VA, and so we keep a close contact with them. They're allowed to obviously still see, even if they're on hospice, they're allowed to still see their providers at the VA under what's called concurrent care. And so we keep them super updated, and that, I think, is important for veterans who have spent maybe many years with their primary care provider, et cetera. So keeping them in the loop. Trying to think what else.
Yeah, I think continuity of care is really a big thing, right? Like you mentioned, that provides some comfort. They don't get continuity of care in military service because they're moving every few years, and their doctors are changing. I totally understand how that is. And so providing some continuity of care can really help them feel comfortable, that they don't have to, retell all the stories that may be traumatizing to them, or the difficulties they've had, because their provider knows them and they know what they've been through.
Yeah.
Can you think of any stories of experiences you had with veterans, or things that, specific stories or patients that have stood out to you that you could share with us?
Yeah, in our line of work, we obviously talk about death and dying a lot, and it's over and over again. I am shocked at the VA how much patients' military experience influences their thoughts on death. They've seen death, especially those that were, in active duty, saw active duty, and you never know which way it's going to go, right? But it really does influence their care and their ideas on how they want to die, and what they think is maybe a good death. I feel like I've seen patients who were very at peace with, I feel like I've lived a good life. I feel like I served my country. I feel like I've kind of tied up all the bows, and put a bow on their lives, and they're very much at peace. And those patients are sort of usually ready to die and more accepting. And then I've seen patients who are sort of traumatized by what they had to do in the military, and death is very scary for those patients because they might not have come to terms with things that they had to do. And so obviously with hospice care, we have chaplains and social workers who are, specifically trained to work with veterans and can help them, process that before they passed away. And so the big thing that I have seen is that their experience really does shape their outlook on death, but we have to dig deeper in order to know kind of in what way, right? Some people feel really proud and really sort of satisfied with everything, and then some people are just really holding on to a lot of guilt, shame, trauma, and need to process that before they can kind of have a peaceful death. So again, got to ask, because we can't know if we don't talk to patients about it.
Well, I really appreciate all of your insights. I mean, I want to thank you for all your service to veterans as well. A very unique group that has a lot of unique medical needs, and it's good to have doctors like you who care for them and want to serve them and are well informed on the needs of veterans. So thank you.
Thank you. Thank you for your service.
No, thank you.